Dobar dan, kolegi. I will continue in English in order to understand each other better. First, I want to thank Amicus and Alcon for inviting me to present here, and I will talk about the Ngenuity. So these are my disclosures here. Sorry for a moment. Now I will briefly make a technical overview. Of course, the benefits and the opportunities. I will not cover the competition at the moment, but it is quite interesting because I do believe that this is a field that will be continuously populated with the new digital visualization systems. So, as the previous speaker, my friend Dr. Ginic said, the system is comprised by a camera, a high processing PC, imaging unit, and really important key element is the screen, which is OLED, the only OLED screen in the available 3D systems on the market, and providing high dynamic range. You will hear during the presentations for Ngenuity a lot the term high dynamic range. What is the meaning of the high dynamic range? The high dynamic range, or the dynamic range, is the ability of the single pixel of the matrix of the sensor to create meaningful image in the condition with the least amount of light and in the conditions with higher brightness. So this is the window of acquisition of a camera. So you can imagine, especially in the posterior segment, we often have situations with low light conditions and a lot of reflections. When you have a camera which is not high dynamic range, it cannot cope with these light conditions and simply show white image. So there is no meaningful information. So the high dynamic range is the window of acquisition of the camera, meaning that here we have larger window. So the dynamic range in the world of cinema is measured in steps. You can often see it in decibels. One stop is equal to 6 decibels. What is the meaning of that? The human eye has roughly 100 decibels dynamic range. Mid-range typical DSLR camera that we use is 40 decibels. High-end cinema cameras like Arri, Red, Sony, etc., they have 78 decibels. And the Ngenuity camera has 85 decibels, meaning that is closer to the human eye in terms of ability to acquire an image. So, what is important and already pointed is that we less often need to refocus during the surgery. It is related to the depth of focus of the system. No need to use multiple screens because all the information can be on our primary screen because of the data fusion ability of the system. And of course, because of the high sensitivity of the camera, we can use low amount of light, potentially limiting the, I would say, fictitious phototoxic effect of the light. So here, these steps were already covered, but I will want to clarify what is increased depth resolution. This means that in all the range of the depth of focus, we have equal amount of resolution. So all the tissues or the points of interest are with similar focal properties. Of course, personalized color profiles are something which I personally really like, and I will show you some really cool things about that. So we rarely speak about instrumental presbyopia and how that affects the overall depth of focus of the visualization system which we are using, no matter if we're using simple analog microscope or it is a combination between a microscope and digital camera. Simply, our accommodation is directly related to the overall depth of focus of the system, meaning that if the surgeon is young and he is working on the microscope, his depth of field plus the depth of field of the microscope is larger than the one where the surgeon is older and is already in presbyopic age. You can hear that in the operating room by buzzing the focus motor. So sorry to say, but elder surgeons are refocusing more because they have shallow depth of field. What is important with the Ngenuity that it provides consistent depth of focus, which is absolutely independent from the presbyopia of the surgeon. Why? Because the screen of the Ngenuity is more like a far vision than near vision. So it's a small detail which is quite important to understand how to use the system. For example, if the surgeon is highly myopic, we know that the high myopes, they rarely use their accommodation, of course, so they like larger images. So we need to adjust the screen image to a high magnification, which will lead the system to a lower depth of focus, and this is getting complicated. But long story short, emmetropes and hyperopes like smaller images, myopes like larger images. This is important how you're gonna start your transition from analog microscope to your Ngenuity. So just to show the depth of focus abilities of the Ngenuity system, here you can see a vessel on the retina directly through the microscope without any contact lens, biome, or something like that. So what is important to note is that Ngenuity adds depth of field effect over the already existing depth of field or depth of focus effect or capabilities of the microscope. So we need to know and assume that the objective of the Ngenuity, meaning the type of microscope that you're gonna put the Ngenuity camera on, will affect the overall performance of the system. I don't know if you are aware, but there is a difference between the stereo base between Müller-Wedel, Zeiss, and Leica. Alcon and Zeiss, they share a similar stereo base, meaning the pathway of the optics. And the Ngenuity camera, albeit highly versatile, you can put it on every type of microscope, works best with Alcon Zeiss microscopes because the sensors are perfectly aligned with the visual axis of the microscope. So have that in mind. Next thing to show is the depth resolution phenomenon. You see the edges of the macular hole and the overall length of my forceps, which is on focus. This is on maximum magnification of the microscope. You know, when we are on the maximum magnification, we have shallow depth of field. This is purely optical law. So here you can appreciate the depth resolution. Next thing, of course, this is vivity. You can appreciate the details over the surface of the lens, which is absolutely remarkable. So this is maximum resolution again with the contrast filter applied on the image, and you can appreciate the texture of the instruments, what is inside the aspirating hole also of the instrument. So I would say that the image is quite good here. You can appreciate the margin of the rexis also. There was a talk about latency, and I would ask you, would I allow myself to tease this capsule like that if there was a latency? I must admit, I do all my surgeries heads up, and I will never come back to the classical oculars because the image perception is absolutely different, and also I'm presbyopic already. So Another example of gonioscopy through Mori gonio lens. And you can see how we can apply different color modifications to highlight different structures of interests here, meaning that the Ngenuity is absolutely useful for angle-based surgery, and in my opinion, for every type of surgery, actually. This is a classic procedure with express implant. The aim of this example is to evaluate the depth of focus. You see all the conjunctiva is in focus and all the tissues are in focus. Later on, you might see high magnification images of sclera with color filtering applied. So this is regular view. This is another filter. Personally, I like one of them because it makes the blood look orange, which is important in social media. The bots will not ban your posts. We know that we communicate in social media now, and the bots are still not trained to recognize blood, which is not red. So there is a OM inbuilt filters inside, which are quite useful. There is a color temperature with which you might play in order to adjust the image according to your preference, but you can play with your own custom filters. So you can do whatever you want with the image, which is the beauty of the open platform of the Ngenuity. So for example, I developed 2 years ago Fundus Reflex Enhancement Digital Filter. This is the regular view of the surgery, my first job, and now you're gonna see the digital filter applied, which maintains the transparency of the pieces, making the surgery more safer because you can see the depth of your reach, and it maintains the fundus reflex. Albeit it's not red, it doesn't matter. You see the transparency here. This is the contrast enhancement filter. This is regular view overexposed a bit, another filter, fundus reflex, contrast. So the aim of this filter is to separate tissues with similar transparency and optical properties. So we need to play somehow with black and white in order to highlight the borders, and I think it's working. This is the example of this filter. This is a pale fundus on high myopic patient, where normally the ILM is difficult to be distinguished without a filter. Of course, we have membrane blue dual staining, but with this filter, again, it increases the contrast properties of the stained tissue compared to the underlying pale retina, and it makes my life easier, at least, to see where are the borders and what I need to peel. Now, something quite interesting and quite new, intraoperative fluorescein angioscopy. This is real-time imaging during surgery. It takes like 5 minutes from your surgery. Now it's a routine practice in our clinic. And you can see a lot of things, especially in diabetic cases or vascular proliferation or occlusion cases. You can distinguish a non-exudative retinal detachment from exudative one. Here you can appreciate more or less diabetic fundus, early phase. You can see that we have a choroidal filling, but where are the capillaries? So for the first time, the Ngenuity becomes, from visualization system, intraoperative diagnostic tool, which can serve us as a intraoperative navigation system. You will see in a moment, probably in the next case. Yeah, I guess here. No, again, this is diabetic case. This is the picture-in-picture functionality of the Ngenuity. We have connected wireless iPhone with pictures from the early stages of the angioscopy, and we can compare even a video file, a video movie shot through the screen with the late phases. Here. No capillaries. So what we need to do, probably laser. Here we have a leaking area, so it's a membrane probably. And something quite interesting, since 1979, Machemer introduced the vitrectomy, and since that time we perform vitrectomy without the ability to see the vitreous because the vitreous is transparent. So with the Ngenuity, we are able to completely remove the vitreous because we see it. We can use high vacuum. You see, I'm here with 566 full pedal to the metal because I see. I don't anticipate where is the vitreous. I see it and I can remove it. So I believe it will transform the way we do vitrectomy. Because otherwise we think that we might clean all the vitreous. So I already mentioned the picture-in-picture capabilities of the system, but in reality you can input whatever diagnostic source you want as a picture-in-picture. You can even put a camera or iPhone or any mobile device with your operating room staff or environment on the side of your screen if you, for example, broadcast your surgery somewhere. So it's something quite interesting. You have like built-in switcher of in the system. So this is something which might serve scientific needs, a thermal vision camera connected to the Ngenuity and simultaneously showing the temperature of the tip. So if you are doing some kind of power modulation study, you might use a thermal camera to validate your assumptions or propositions. So even that is possible. Something absolutely important here. I don't know why the video doesn't work, sorry. What happens? Can I have my slides back, please? Another one, and hit play here. There should be a video. This is a patient which is with fairly difficult positioning. In the past, we need to do this surgery stand up or something like that. Here, we can tilt the microscope or we can place the patient however we want, and we can operate in fairly routine fashion. It is important for live streaming, for broadcast, recording, teaching. For example, we are printing a QR code on our discharge documents with the surgery of the patient, so every patient can see his own surgery, or he can consult another colleague if he has some doubts or something else. And it's quite useful in terms of medical legal angle of the situation. Ngenuity is already in Metaverse. We know that somehow the Metaverse will take over Facebook or something like that. There are meetings which are already carried out in MetaMet, and since they are in 3D, you need to have Ngenuity videos in order to participate. So this is the next step in the future. This is the option which you can order from Alcon, and it's a pedal with which you can command your Ngenuity. In one side, it is really convenient because you don't need to ask your colleague or nurse, give me this step, give me this filter. You can toggle them with your footsteps. On the other hand, if you don't use a constellation machine, so you cannot command the Ngenuity through the pedal of the constellation machine, you can have a standalone communication with your Ngenuity, and albeit you are not Alcon user as a machine, you can be an Alcon user as a visualization system. This is the evolution of the system, and what is really important is the data fusion. And I must point that the only machine in the market which is capable of wireless data fusion is actually Centurion with the Ngenuity, meaning less cables and tripwires in the operating room. And thank you for your attention.